Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. You know, when people think of ENT specialists, they clearly think ear, nose, throat, right? But these doctors also perform thyroid and parathyroid surgeries often, and that can help manage some complex endocrine conditions. So joining me today to talk about this is Dr. Mark Sheridan. He's an ENT with Valley Health. Thanks so much for being here.
Thank you.
Let's talk about thyroid, parathyroid. Explain to me what that is exactly and what function it has in the body.
So the thyroid is really sort of the second master gland for endocrine problems, hormone issues. And when I say that, it produces a hormone that helps the rest of the body function more normally. Weight loss, hair loss, nail growth, things like that can affect our effects of the thyroid. Parathyroids are actually next to, that's all that para means, next to the thyroid. They're very tiny glands, and they control the calcium in our body.
Very important things in our bodies. What would give people an indication that maybe their thyroid, their parathyroid is malfunctioning?
So for thyroid, if it's overfunction, you may have significant weight loss. You may have hot flashes. For women, you'll have irregular menstrual cycles if you're in that stage of life. Hair falling out, which can happen both with overactive and underactive. Jitteriness, heat intolerance if it's overactive. If it's underactive, you're cold all the time. You're gaining weight because your body, your digestive system doesn't work well. The fuel, you're needing more and more fuel to keep that body warm. In the winter months, you complain about that all the time. Brittle nails, hair fall out. You may notice a lump in your neck, and that can be something.
Okay, so first step, you discovered there's a problem. What's your first line of therapies to do?
So the first thing really is hopefully your primary care has already checked your thyroid function. There's a blood test for that. It's called TSH. TSH is a signal from the brain, the pituitary gland, tells the thyroid to work. I generally like to get a TSH, or thyroid stimulating hormone. That is a chemical that comes from the brain, actually the pituitary gland, which is in the brain, tells the thyroid to function, to make hormone, to send out active hormone. The most active hormone is one we call free T4. And I like to check that depending on what the symptoms are to see if it's either underactive or overactive. And I follow that pretty closely with my thyroid patients because most of the time, if you've gotten to me, you've either had surgery or you're on thyroid replacement hormone.
What kind of problems could you have with your parathyroid gland?
So the parathyroid gland, usually the problems with that will present when your doctor just does a metabolic check and routine yearly blood work, and they'll notice the calcium seems elevated. So if it's elevated I usually recommend getting it at least twice to make sure it's not a false reading. And if it's elevated, we get a test called a parathormone assay. And if that's elevated, that's the hormone secreted by the parathyroid gland. And that sort of helps in the metabolism of the calcium in our bloodstream, in our bodies, which we need so we don't have terrible cramping or things like that. If you have too much, it will actually suck the calcium out of your bone, which is a big deal for ladies, for osteoporosis, osteopenia. So if that's elevated, then we usually get either an ultrasound or there's a specialized nuclear test we call a sestamibi that looks for one of these glands being hyperactive. And if it's hyperactive, that kind of tells us that is probably the abnormal parathyroid gland. And unfortunately, as of today, the best treatment is surgical removal of that.
When do you make the jump that, yeah, it's time for surgery?
So one of the things, if you get far enough to see me, or if I've talked to your doctor, and let's say you have a nodule we see, and there's certain characteristics we look for on the ultrasound to see, we'll send you actually for them to stick a little needle in there and obtain some cells. And the cells will be sent off to our pathology colleagues, and if they see certain characteristics, they can tell us that there's a high likelihood of it being malignant or cancerous. So if it comes into the gray zone, we send it for the genetic testing, which can most often tell us almost no risk of cancer or significant risk of cancer. In which case, if it comes back obviously on that significant side, we recommend thyroid surgery.
And what does life look like after that surgery and management if you go that route?
So most of the time, if it goes well, you may have to take thyroid replacement. Sometimes, even in malignant processes, we only need to remove part of it. But generally, you're looking at losing the entire thyroid gland. And then you need to take a medication called Synthroid. It has various levothyroxine, and there's some other combinations that we'll use to replace it. And most of the time, once we get you equilibrated on that, you should function fairly well, fairly normally, and everything should kind of ease back more to normal.
All right, that's hopeful news for people who are looking at this as a possibility. Dr. Sheridan, thank you so much. We appreciate your time.
Welcome.
Thanks for checking in on Monday Health Minutes.